So this is a case that just is on my to-do list. I'm going to go ahead and use the new flow, and the spacebar is the one that goes from each step. So we'll go ahead and hit begin review. I did bonding on these upper twos because they were pegged before we actually scanned. So, and then my vertical reference is the upper ones. And I don't think there's any other notes. We've got the arch wire is a medium small, or 92% and 84%, and then we've got IPR of 0.3. So I'm going to copy both of those into my chart, and then we'll go ahead and go through the overview. So we're going to check marginal ridges first. Those usually I don't have a lot to change on them. Again, as Brandon Owen says, marginal ridges are an area, it's not a specific point. So we'll hit space for next. On the lower, they all look good. For tip, this is where I spend most of my time because it's the one repo I don't want to make, and I'm often using the roots as well as the marginal ridges to kind of make sure that they're both telling the same story, as it were. So as we look through this side, that looks pretty good. I often find that my fives here struggle, so I'm gonna, my lower fives often feel like that they are a little bit too gingival when I look at them. We'll come back to that in a second. So go the other side. Hotkeys are super helpful. Again, here's my 5 that sits low. I feel like, at least in my setups, that's not uncommon. The actual tip looks not bad in the posterior. Now I'm going to look at tip in the anterior. There isn't a screenshot for that necessarily. And while I prioritize the roots and the marginal ridges in the back, and M is the marginal ridges, then I am going to prioritize the crowns in the front over the roots, which is what my instructions say, though sometimes that doesn't always happen. So U for gums, at least that's my hotkey. I'm not going to stress too much on these because I actually shaped these laterals, and so I can obviously reshape them again. Tab is what will go from arch to arch if you're not clipped on a tooth or its next tooth. Tip is almost always off for me on these laterals and canines. I constantly feel like I'm putting some distal root tip or mesial crown tip on those. Again, I'm going to prioritize crowns over roots, and then oftentimes I'm bringing these laterals up just a little bit because I know that I can do some enamelplasty on those. And I feel like they often leave those low for me. And now I'm going to come back. If I look at marginal ridges here now, see, this is where this doesn't make sense. So even though I'm still in kind of tip mode, I'm going to try to adjust my marginal ridges so that they make some sense. I'm going to look sometimes right here just to look at the height of the cuss tips, and hit M again. Still feel like this could come up some. And I've got a similar thing going on here. I'm going to review my tip here just a little bit. Alright, so spacebar here, torque review. Oftentimes the torque review, this is shown because you can kind of look and see if there's any hanging lingual cusps. In the front, the intention is to kind of look across and see kind of how that, I guess, facial looks like, and then looking at lingual here. Now, I'll look at torque a little bit later in a different way. Here we're looking for, do the kind of buckle surfaces match? Same thing here. I'm going to put on gingiva because I know that Brandon Owen often will kind of angle this so you can see that the cusps are about the gingiva. And I'm going to maybe reduce that buccal root torque a little bit right there. We'll look at same thing on the anterior. I will often look down from the occlusal for this facial view on the torque. And for me, usually my setups usually take a bit longer than others. I'm a little bit more, I guess, OCD, so they usually take me around 10 minutes or so. And then we're looking at the torque here. That looks good. Alignment and symmetry. First thing I'm going to do is take off the grid and the arch wires and the brackets to make it a little bit less messy, take off marginal ridges, and I'm looking now at rotations. Oftentimes I feel like these 6s are measly rotated in. These ones don't look bad. We're going to do the same thing over here. G for grid, A for arch wire, B for brackets, M for marginal ridges. That's just my preference. And then now that we've already done the tip, now we're looking at rotations. For me, I bond lower 3 to 3, and so I'm often having to adjust these lower 3s and the 2s, and maybe step it in just a little bit. Now you'll see this is where I'm looking at torque. I see a lot of the facial on that too. So I may even get rid of the gums and look at the roots there. I'm going to see if I can step out that 3 a little bit. We'll take a look. It looks like the tip is still off, which is going to help in that mesial out rotation a little bit. And I don't look at it right here because you often are looking at the mouth about right here, and you can see that I still have a little bit of mesial in for my like on those 3s. And then if I'm looking at torque again, I'm looking at maybe this one right here. Needs a little bit of lingual root torque. And then I'm going to do the same thing real quick on the upper. And then I'm going to add the lower, because sometimes I look at like rotations in the mouth here, and it looks like I can maybe step this in, because if anything, I'm probably going to need to add some bulk to those laterals. And I'm going to hit tab for this root. I'm going to go ahead and position this root ideally, knowing that I can do some bonding there as needed to change that or change the shape of that. So in this case, I'm going to prioritize the root a little bit more. Now I'm also going to see where that root started, so at least I know it's makes sense. Okay. So now for the occlusion, it takes a while for this occlusion to come up, so I'm going to pause it for a second. Okay, so now we've got our occlusion. One of the things I'm looking for here is also my torque. So let me see, one of the things I'm watching is how much buccal root tip are we getting? Is that realistic? So that's quite a bit on the 7s. I may cheat and just reduce some of this uprighting. And is it going to go? It's lagging because I'm trying to record and do some 3D modeling here. And then I may even just reduce some of that. Again, because sometimes I'm worried how much, where is that cortical plate there? And is that root going to be able to do that movement? Because if not, and it hits the cortical plate, then the crown comes lingual. So that is one of the things I'm looking at. And when I'm looking at this 7 here, if I just give it some rotation, I'm wondering sometimes that will also help my occlusal contacts. See, it already improved this one right here. And same thing probably for this one here. I'm going to look at the actual overjet, because sometimes I feel like they leave my overjet pretty tight at the 6s, and that one is, and that's got quite a bit of buccal root torque. So I am going to give myself some buccal root torque back, and then now we can bring that tooth back down. That looks pretty good. We've still got one hard contact on this 7, so we're gonna, that's a lot of buccal root torque. I'm gonna take a little bit out and bring a little bit back in here, just because I worry that sometimes even when you get this movement here, you don't always get the root coming lingual on this cantilevered last bracket. You'll probably get the crown coming buccal more easily. So I'm going to treat that there. And then it looks like our last occlusal contact, we're going to come back to the anterior, get rid of our arch wire, is at this canine. I can probably bring these canines down a smidge. And it looks like it is hitting on the canine there. I can reduce some of that mesial in. And then I can probably bring this back in just a tad. And it still looks a little high to me if I have to guess. Now, one of the things I always do for tip also in my anteriors, I'll put the brackets back on these anterior teeth, and I'll look at them based on where the brackets are being placed, just to make sure it makes sense with my eye, that that's kind of how I would be thinking of that bracket position. And that all seems to match up there. And then I'm going to do the same thing on the top real quick. And mostly I'm looking at tip here, and that matches my eye too. So occlusion and interdigitation here. I'd probably make a note in my chart that we're not going to get complete class 1, likely due to the Bolton here. And it's not showing any global movements here, but I'm going to hit D for my actual displacements here, and I'm going to look, because it looks like I want to match the upper and the lower and the posterior. So on the upper, we've got about 2 millimeters coming forward on the right and 1 on the left. On the lower, 2 millimeters on the right and about 1 millimeter on the left. So those match for me. So there's no hidden global movements in this setup. I've got my shortcut key for X for my IPR. So there's our IPR here. Now it looks like we've got a little bit there. We'll just get rid of that. That looks good. And then I'm going to check again my interdigitation here. Even though this is bonding, I'm going to cheat that a little bit because I want this transition at the lateral to the canine to look more natural. Spacebar for next. Heights. Now one of the things I'm going to do here is that I am going to check the Ceph orientation just to see what that occlusal plane looks like, so that I can then kind of match this to that orientation as I look at my heights. That looks pretty good as I'm looking through this. I might plan on doing a little bit of IPR between those upper ones. And I'm going to get rid of some things just to get a better idea. I'm going to look at her picture over on my other screen just to again verify can't. And I'm going to set this up because it looks like if anything, she may have a very slight cant that looks like that. So if I do that now, I may actually just adjust this slightly compared to what I'm actually seeing in her pictures. Alright, that looks good. I check my contacts again. That still looks good there. For my heights on the lower, I'm also looking at these 4s and 5s. And it looks like I've got still a little bit of a heavy contact there. This root could come forward. Alright, that looks good again. So spacebar. We've got a little bit of some IPR here we need to get rid of. Looking at brackets. Now the other thing I'm going to look at real quick is to make sure if I have a bracket that's kind of next to the gingiva, sometimes I'll take a 7 and I'll actually just bring it back down, even if it's out of occlusion, to get it where we can bond it. I'm going to look, of course, and make sure that the brackets aren't over any gingiva here. That looks good. I want to check and make sure, can that bracket actually be bonded and a wire in? I think so, especially with the twin 0-2 nickels. And then we're gonna put this back on. Are there any bracket interferences? It doesn't look like it. Sometimes there are some on the 6s. I don't stress too much about it because oftentimes it's the actual bracket pad and that's not going to be a problem. Or if it becomes later on. One of the things I don't do is I don't want these brackets too low on the incisors, because sometimes if they get on the rounded portion of the incisors, you don't get a good bond. There's too much variability in that tray and the glue, and then you don't get what you want to express. So if anything, sometimes I will cheat those up a little bit. See if we can get so we're going to adjust the lower a little bit, other direction. Just so I can get them a little bit higher on the actual incisal flap portion. Alrighty. So I feel good about that. And there we are done. Of course, that only took me closer to 20 minutes because I'm kind of talking through it and learning a new system, but that's the detailed things I look at. Hopefully that's helpful. You guys are awesome.